EPM, or equine protozoal myeloencephalitis, is a disease affecting horses' central nervous system. As a horse owner who has had a horse that suffered from EPM, new advanced and effective treatment options are important. Over time, the treatment options for EPM have expanded and improved because of research. Most times when a horse was diagnosed with EPM, the end was fatal, permanently affecting the horse's brain functions, spinal cord, and immune system. However, improving technology has changed the course so EPM horses can live healthy lives. Signs of EPM were first brought to attention when multiple horses that were together started to show neurological issues that were unlike any other research diseases. The first group of horses with EPM were racehorses from Kentucky. J.R. Rooney was the veterinarian who first diagnosed and treated EPM. With further research, another veterinarian, Dr. Doobie, suggested the EPM was caused by a parasite called Seracositis. In 1991, an affected horse's spinal cord was cultured and Seracositis was discovered to be developed within neurons. Ohio State University, Animal Ecology and Epidemiology Research, 2018. For a horse to be infected with EPM, it must come in contact with Seracositis. Possums are the most common host of this parasite. The parasite spreads through their feces. For a horse to come in contact with Seracositis, they ingest an affected possum's feces by eating infected grass, hay, grain, or drinking infected water. The horse's bloodstream would then bring the infection to cross the blood-brain barrier in order to infect the brain and spinal cord. It is estimated that 50% of the horses have been exposed to Seracositis, but only a small percentage, less than 1%, develop EPM, and the others develop antibodies. Amy Young, Equine Protozoal Myeloencephalitis, EPM, 2019. To know if a horse has developed the disease, there are common neurological signs that would indicate the presence of EPM. Sometimes neurological issues are not always prominent at first. Most EPM signs can start off as issues of balance, trouble engaging the rear end, sore back, or collapsing. If EPM goes undetected, it can lead to more serious issues such as partial paralysis, seizures, and muscle atrophy. Some horses have a higher risk factor of contacting EPM than others, which is why not all horses who ingest Seracositis develop EPM. Horses that live in areas with higher populations, like Kentucky, Michigan, Missouri, Ohio, and Tennessee, have a higher chance of EPM. Younger horses and horses with a compromised or low immune system are more at risk because when ingesting Seracositis, their body won't make those antibodies. Male horses are a higher target because they are twice as likely to develop EPM compared to female horses. Casey Basie, EPM in Horses, Causes, Treatment, and Long-Term Management, 2023. Before EPM was a commonly known disease, the common way to treat EPM was to prevent it. The most common methods of prevention are building up the immune system through vitamins, minerals, and feed supplements. Another practice is to prevent possum feces from ever entering the horse's bloodstream. This can be done by practicing safely storing food, such as in sealed bins and in a closed room. Avoiding feeding on the ground and making sure fresh water is always available is also a preventative measure. Seville, WJA, Intraobservation in the Diagnosis of Neurological Abnormalities in Horses, 2017. However, with more research, treatment options have expanded and become successful. When diagnosed with EPM, horses should be treated as soon as possible to prevent permanent or more intense issues. The most common FDA-approved treatment options is a 3-step process that involves Pinazeral, which is marketed as Marcus, and this is administered once daily for 28 days. Diclofenac, which is marketed as Protozil, is a pelleted alfalfa-based top dressing, which is fed for 28 days. And lastly, sulfonylureas and primethine, which is marketed as Rebalance, an oral suspension, is administered once daily for as long as 120 days. This method does not kill the EPM-causing parasite 100%. It reduces the numbers greatly so that the horse's immune systems can do the rest. More research has been done for alternate treatment options. Most of these options are an expansion of the standard treatment option, such as using co-administration of corn oil and Pinazeral serum. This newer technique was created as a paste for horses to ingest over 21 days. Results show that this treatment improves cerebrospinal fluid concentrations of panazeral. The level of panazeral was greater in horses that received panazeral with the oil than those that did not. This method treats horses at a quicker and more effective rate. Co-administration of corn oil and panazeral serum enhances the treatment for EPM. Faster and more effective treatments can prevent further deterioration of the horse's central nervous system so that they can live a healthy life. For N effects of co-administration of corn oil and panazeral serum. 2020. EPM is a rare disease among horses. It is a very serious infection that must be caught early on to prevent serious brain and spinal cord damage. There are only a few different treatment options that are the standard. With more EPM research, different methods have been more effective in treating and preventing further damage to the central nervous system. As treatment options evolve, so do preventative measures. There is a better understanding of EPM, so preventative measures have reached a higher standard to continue to keep horses healthy. Evolving knowledge and research on EPM has improved the lives of many horses that suffer from EPM.